Hi class, my name is Sonya Barnes, and this week my topic is on sexual dysfunction. Sexual dysfunction is a disorder in which people cannot generally respond in critical areas of sexual functioning, which makes it difficult or impossible to enjoy sexual intercourse. Human sexual response can be described as a cycle of four phases, which contains the desire, excitement, orgasm, and resolution. Sexual dysfunction affects one or more of the first three phases. The resolution consists of the relaxation and reduction in the arousal that follows orgasm. The desire phase is of sexual response cycle consists of urge to have sex, the sexual attraction to others, and for others to have sexual fantasies. Two dysfunctions, two dysfunction affects the desire phase, which is the male proactive, hyperactive sexual desire disorder and female sexual arousal disorder. Men with male hyperactive sexual desire disorder persistently lack or reduce interest in sex or engaging in little sexual activities. However, the male does have sex and their physical response may be healthy, but they may even enjoy the experience. The culture plays a role in how men see themselves as wanting to get as much sex as they can. But 18% of males worldwide have this disorder. The number seek therapy has increased during the past decade. Women with female sexual interest disorder, arousal disorder, also lack regular interest in sex, rarely intimate sexual activities, excitement during sexual activities, and are unaroused during foreplay, and have few genital or non-genital sensations during sexual activity. As many as 38% of women worldwide have reduced sexual interest and arousal. During the excitement, the disorder of excitement is marked by the changes in the pelvic region, general physical arousal, an increase in heart rate, muscle tension, blood pressure, and rate of breathing in men. The blood pool in the pelvic area and leads to the erection of the penis. And in women, swelling in the clitoris as well as lubrication in the vagina causes excitement. However, a male disorder, erectile disorder, involves dysfunction during the excitement phase only. The orgasm phase of the sexual response cycle, a person's sexual pleasure peaks and sexual tension is released as the muscles in the pelvic region contracts and draws together. The dysfunction of these phases are sexual response cycles are premature ejaculation and delayed ejaculation in men, and female organs display disorder in women. Many men suffer from premature ejaculation with 1 minute of sexual activity. Delayed ejaculation is when the male is unable to ejaculate or have a delay in doing so during sexual activity. Sexual dysfunction is a marker a future cardiovascular risk of erectile dysfunction disorder, and is considered a marker for future cardiovascular events and gatherings in the quaternary of the coal mine. However, when men are detected with diabetes, it changes everything because they develop erectile dysfunction. The erectile dysfunction has been organized in the nuclear vascular complication that occurs in 35 to 90% of men years earlier than in men without diabetes. Females' sexual dysfunction comprise a spectrum of clinical conditions involve sexual desire, arousal, orgasm, and female genital pelvic pain. The same prevalence of the female sexual disorder and diabetes is still a matter of debate because LinkedIn disorders in this diagnosis and clinical impact. I hope you enjoyed my presentation, and I look forward to reading your questions from my comments. Bye.